All right, our last medical emergency of the day is to talk about seizures, what to do in the case of a seizure. Now, before it was called a seizure, up until the late 1960s, early 1970s, they actually didn't call it a seizure. They called it a certain type of fit. So, I don't know if that's very rational, but a certain type of fit called an epileptic fit. The word epilepsy in Latin means of unknown cause or origin. We don't know what caused it or where it came from. So in the case of a seizure, it is an abnormal electrical activity of the brain, and we don't know what caused it. Now, that's not always true. Sometimes we do know what caused it. If you got hit in the head or you took too many drugs, then we do. So we can't call it epilepsy if we know. We can only call it epilepsy if we don't know. So if you've been deemed epileptic, by definition, in medicine, that means we don't know the cause. But we do know that people have seizures or abnormal electrical activity of their brain for other reasons. So they had to change the term from epileptic fit to seizures because sometimes we know and sometimes we don't. So here's a few things that cause seizures. It certainly is abnormal activity of the brain. The cause might be known or unknown. And still to this day, the most common is unknown, which means the most common is called epilepsy. But it could also be from a head injury or high fever, especially in young children who can't control their temperature, lack of oxygen, such as choking, drowning. It could be from stopping breathing for other reasons. It could be from drugs or alcohol, or drug or alcohol withdrawal can cause seizures. Could be from diabetic emergencies or hits to the head. There's lots of things that can cause seizures to occur. Whatever the reason is, you are not going to change the electrical activity of their brain, where you are right now, and what you're doing. So if someone's having a seizure, it's important to do two things. One, call for help. But you might be saying, well, hold on. We work at Give Kids the World. Kids have seizures all the time. Okay? So if their parent or guardian says that everything's okay and this is very normal, we can trust them to do that. But if you have any doubt whatsoever, or you're not sure, call for help. One of two things is going to happen. We're going to get there as paramedics, and this situation will have resolved, and the parents are going to tell us to take a hike. This is normal. We'll make sure everyone's okay. We'll leave. It's fine. Totally fine. Or we'll get there. This was abnormal. This lasted longer than usual, or this was the first time and they didn't know. And you'll be awfully glad that the paramedics have arrived, because you don't want to wait 7 or 8 minutes after they stop breathing to call. That's a disaster. So call for help. You don't have to have a big fight with anyone. You don't even have to tell them. Just say, oh, I'll be right back in a second. Disappear, make a phone call. We'll show up. Trust me, I have no problem with rejection or fighting parents that wish I weren't there because their kids have seizures 10 times a day. Totally fine. I can deal with that. At least I know I was there to help if I needed to be. I'm going to go back to my station knowing that they're in good hands with their parents and everything's fine. But at least if I was needed, we can help breathe for them. We can help do CPR if it gets to that point. We can certainly care for them and get them the help that they need if that is something that they need to do. So, airway, breathing, circulation, call for help, all the things we really do for everyone else. And if they start to recover from the seizure itself, just keep an eye on them, make sure everything's okay with them. But again, you've called for us, so we'll take care of it once we get there. All right, that's it for seizures. Pretty straightforward. We just see a few of the steps. Call for help. Do not restrain them. I should mention, because I kind of forget that people maybe still do this, which is crazy, but don't put anything in their mouth. They're not biting their tongue. They're not swallowing their tongue. If they do bite their tongue, they have a little bit of bleeding. That's okay. But it's going to be better that they bite their tongue than crush whatever weird thing you're about to stick in their mouth and give them some sort of weird aspiration pneumonia. So nothing in their mouth, not your fingers, because they'll bite them off sometimes. So don't put things in their mouth. Just leave it alone. Keep their airway clear. Once they're done seizing, comfort them, reassure them, roll them into what's called the recovery position. You see it up above here. That just simply means on their side so that they can have an easier time breathing and recovering from their incident. And again, the paramedics are on their way anyhow, so we'll be there right away. So comfort, reassure them, make sure the scene is safe, nothing in their mouth. Don't hold them down. They're super strong. If they're strong enough To hurt you, they will. If they're not strong enough to hurt you, they may hurt themselves because you're overpowering them. So just leave them alone, support their head and their neck, call for help, comfort, reassure them. We'll be there as soon as we can. So that is seizures.